Okay, this is Chapter 5 of the Mental Health ATI, Creating and Maintaining a Therapeutic and Safe Environment. Therapeutic encounters can occur in any nursing setting if a nurse is sensitive to a client's needs and use effective communication skills. The therapeutic nurse-client relationship is a foundation to mental health nursing care. The therapeutic nurse-client relationship differs from a social and intimate relationships. A therapeutic nurse-client relationship is a purposeful and goal-directed, well-defined with clear boundaries, structured to meet clients' needs, and characterized by an interpersonal process that is safe, confidential, reliable, and consistent. Milieu therapy creates an environment that is supportive, therapeutic, and safe. Milieu therapy can also be called therapeutic community or therapeutic environment. Management of the milieu refers to the management of the total environment, physical and psychosocial, of the mental health unit in order to provide the least amount of stress, ensure client and staff safety, managing behavioral crisis while promoting a client's belief in their own abilities towards recovery and improved functioning. The goal is that while the client is in the therapeutic environment, the client will learn the tools necessary to cope adaptively, interact more effectively and appropriately, and strengthen relationship skills. The hope is that the client will use these tools in all other aspects of their life. The nurse, as manager of care, is responsible for structuring and/or implementing aspects of the therapeutic milieu within the mental health facility. One structure of the therapeutic milieu is regular community meetings, which include both the client and the nursing staff. Characteristics of the therapeutic milieu. Physical setting. The unit should be clean and orderly. The setting should include comfortable furniture placed so that it promotes interaction, solitary spaces for providing and thinking alone, comfortable places conducive to meals, and quiet areas for sleeping. The color scheme and overall design should be appropriate for the client's age. Materials used for such features as floors should be attractive, easy to clean, and safe. Traffic flow considerations should be conducive to client and staff movement. Healthcare team members' responsibilities. Promote independence for self-care and individual growth in clients. Treat clients as individuals. Allow choices for clients within the daily routine and within individual treatment plans. Apply rules of fair treatment for all clients. Model good social behavior for clients, such as respect for the rights of others. Work cooperatively as a team to provide care and maintain boundaries with clients. Emotional climate. Clients should feel safe from harm, self-harm as well as harm from the disruptive behaviors of other clients. Clients should feel cared for and accepted by the staff and others. Therapeutic nurse-client relationship. Roles of the nurse. Ensure self-awareness and evaluation of their own beliefs, values, and behaviors. Consistently focuses on the client's ideas, experiences, and feelings. Identify and explore the client's needs and problems. Facilitates therapeutic communication. Discusses problem-solving alternatives with the client. Help to develop the client's strengths and new coping skills. Encourage positive behaviors change in the client. Assist the client to develop a sense of autonomy and self-reliance. Provide education to the client and family about the environment, expectations, disorders, medications, symptom management, and rights of the client. Orients the client and family to care environment, treatments, and expectations regarding safety as well as expected behaviors. Establish welcoming trauma-informed environment. Enables health promotion through education. Select and advocate for activities that promote participation, recovery and healing, portray genuineness, empathy, and a positive regard toward the client. The nurse practices empathy by remaining non-judgmental and attempting to understand the client's actions and feelings. This differs from sympathy, in which the nurse allows oneself to feel the way the client does and is non-therapeutic. Benefits of the therapeutic relationship. Therapeutic relationships contribute to the well-being of those who have mental illness as well as other clients, although the treatment goals will be individualized. These relationships take time to establish, but even time-limited therapeutic encounters can have positive outcomes. Therapeutic relationships have a positive impact on the success of treatment. Collaboration with peers and the clinical interdisciplinary team enhances the nurse's ability to examine their own thoughts and feelings, maintain boundaries, and continue to learn from nurse-client relationships. Factors that positively affect the development of the therapeutic relationship include nurse factors, consistent approach to all interactions as therapeutic encounters, adjustment of pace to client's needs, attentive and active listening, positive initial impressions, comfort level during the relationship, self-awareness of own thoughts, values, and feelings, consistent availability and follow-through, therapeutic use of self and creating a nurse-client alliance, client factors, trusting, attitude, willingness to talk, and active participation. Establishing boundaries and therapeutic relationship. Boundaries must be established in order to maintain a self and professional nurse-client relationship. Blurred boundaries occur if the relationship begins to meet the needs of the nurse rather than those of the client, or if the relationship becomes social rather than therapeutic. Social relationship. Primary purpose is for socialization or friendship with the focus on a mutual needs of the individuals involved in the relationship. Therapeutic relationship. Primary purpose is to identify the client's problems or needs and focus on assisting the client in meeting or resolving those issues and foster a safe, healing, therapeutic milieu that is focused on improved quality of life and recovery. The nurse must work to maintain a consistent level of involvement with the client, to reflect on boundary issues frequently, and to maintain awareness of how behaviors can be perceived by others, clients, family members, other health team members. Transference occurs when the client views a member of the healthcare team as having characteristics of other person who has been significant to the client's personal life. Transference may be positive or negative. It is positive if the client is motivated to work with the nurse toward their recovery and the meaningful work of recovery. It is negative if the client directs anger or painful emotions toward the healthcare team member. The nurse will need to explore the client's response. Behaviors. Client expects exclusive services from the nurse, such as extra session time. Client demonstrates jealousy, anger, hostility, or extreme affection for the nurse or the nurse's time or attention. Client compares the nurse to a former authority figure. For example, a client can see a nurse as being like their parent and thus can demonstrate some of the same behaviors with the nurse that they demonstrated with their parent. Nursing implications. A nurse should be aware that the transference by a client can reiterate their role as nurse and attempt to redirect the client towards goals of treatment. Countertransference occurs when a healthcare team member displaces characteristics of people in their past onto a client. The behaviors. Nurse overly identifies with the client, nurse competes with client, and nurse argues or expresses intense emotions toward the client. Nurse is overly or underly involved with the client. For example, a nurse can feel defensive and angry with a client for no apparent reason if the client reminds them of a friend who often elicited those feelings. Nursing implications. A nurse should be aware that the client who induced very strong personal feelings can become objects of countertransference. The nurse may need to a supervisor or peers for support in responding objectively to the client. Nurse phases and tasks of the therapeutic relationship. Orientation. Introduce self to the client and state the purpose. Set the contract, meeting time, place, frequency, duration, and date of termination. Discuss confidentiality. Build trust by establishing expectations and boundaries. Set goal with client. Explore the client ideas, issues, and needs. Explore the meaning of testing behaviors. Enforce limits on testing or other inappropriate client behaviors. The client is to meet with the nurse, agree to the contract, understand the limits of confidentiality, understand the expectations, participate in setting goals, begin to explore own thoughts, and explore the meaning of own behaviors. Working. The nurse is to maintain a relationship according to the contract, perform ongoing assessment to plan and evaluate therapeutic measures, foster positive behavioral change, explore and deal with resistance and other defense mechanisms, support the client's adaptive alternatives and use of new coping skills, and remind the client about the date of termination. The client is to explore problematic areas of life, reconsider usual coping behaviors, examine own worldview and self-concept, experience intense feelings and learn to cope with anxiety reactions, test new behaviors, and try alternative solutions. And the termination phase. The nurse is to provide opportunity for the client to discuss thoughts and feelings about termination and loss, discuss the client's previous experience with separation and loss, elicit the client's feelings about the therapeutic work in the nurse-client relationship, discuss ways for the client to incorporate new healthy behaviors into life, and maintain limits of final termination. The client is to discuss thoughts and feelings about termination, examine previous separation and loss experiences, Review goals and achievements. Discuss plans to continue new behaviors. Express any feelings of loss-related determination. Make plans for the future and accept terminal as final. Client safety. The nurses' station and other areas should be placed to allow the easy observation of clients by staff and access to staff by clients. Special safety features such as bathroom bars and wheelchair accessibility for clients who are disabled should be addressed. Set up the following provisions to prevent client self-harm and harm by others. No access to sharps or otherwise harmful objects, restriction of client access to restricted or locked areas, monitoring of visitors, restriction of alcohol and illegal substance access or use, restriction of sexual activity among clients, deterrence or elopement from facilities, rapid de-escalation of disruptive or potentially violent behaviors through planned interventions by trained staff. Seclusion rooms and restraints should be set up for safety and used only after all less restrictive measures have been exhausted. Plan for safe access to recreational areas, teach fire, evacuation, and other safety rules to all staff, and when private rooms are not available, considerations of room assignments on 24-hour care units should include personalities of each roommate, the likelihood of nighttime disruptions, mental health and medical diagnosis such as how two clients who have severe paranoia might interact with each other. Activities within the therapeutic milieu. Activities are structured and included time for the following. Community meetings on the mental health unit should enhance the emotional climate of the therapeutic milieu by promoting interaction and communication between staff and clients, decision-making skills of clients, a feeling of self-worth among clients, discussion of common unit objectives, discussion of uses of concern to all members of the unit, including common problems, future activities, and the introduction of new clients to the unit. Meetings can be structured so that they are client-led with decisions made by the group as a whole. Individual therapy is characterized by scheduled sessions with a mental health provider to address specific mental health concerns such as depression and trauma. Group therapy is characterized by scheduled sessions for a group of clients to address common mental health issues such as substance use disorder and anger management. Psychoeducational groups are based on clients' level of functioning and personal needs, such as adverse effects of medication, coping skills, and strategies. Recreational therapy and activities use leisure time and socializing with others to benefit mental health. This is activities, exercise, game, and community outings. Unstructured flexible time includes opportunities for the nurse and other staff to observe clients as they interact spontaneously within the milieu. A nurse is talking with a client who is at risk for suicide following their partner's death. Which of the following statements by the nurse explains the purpose of milieu therapy? Milieu therapy is focused on creating a safe, healing, therapeutic environment. A charge nurse is discussing the characteristics of a nurse-client relationship with a newly licensed nurse. Which of the following characteristics should the nurse include in this discussion? All encounters are goal-directed, positive behavior changes are encouraged, and promotes balance of a client autonomy and safety. A nurse is planning care for a termination phase of a nurse-client relationship. Which of the following actions should the nurse include in the plan of care? Discussing ways to use new behaviors.